Pyoderma in dogs, causes, treatment, and prevention. Pyoderma is a bacterial skin infection that can cause itching and discomfort in dogs, though it often appears more serious than it truly is. Dogs with underlying health conditions affecting their skin, immune system, or endocrine system are particularly prone to this infection. The condition is caused by naturally occurring bacteria that lead to pustules and scabs on the skin. While mild cases of pyoderma may resolve on their own within a few weeks, more severe cases may require topical or oral antibiotics to heal. Since pyoderma can occur due to underlying conditions that compromise a dog's immune system, it is important to consult a veterinarian for proper diagnosis and treatment. The infection is similar to impetigo in humans and is often caused by the same bacteria. What is pyoderma in dogs? Pyoderma refers to a skin infection caused by bacteria that creates pustules, small, pus-filled bumps, that rupture and develop into crusted lesions, often found in areas with sparse fur or skin folds. This condition is usually a sign of an underlying health issue, as it indicates that the skin's natural defenses have been compromised. Symptoms of pyoderma in dogs. The signs of pyoderma are most often visible on the chin, belly, or other areas where the dog's fur is thinner. Pet owners should be alert to the following symptoms: pustules, small, pus-filled bumps; papules, small, raised bumps; hot spots, round lesions with scabs around the edges; flaky or peeling skin; crusting, especially if pustules rupture. As the pustules and papules burst, they leave behind circular lesions that become scabbed over. The itchiness associated with pyoderma can cause dogs to scratch the affected areas, leading to further redness, bleeding, and skin damage. If the condition becomes severe, the discomfort may cause the dog to become lethargic, depressed, or lose its appetite. What causes pyoderma in dogs? The exact cause of pyoderma is not fully understood, but it typically results from bacteria that are naturally present on the skin of all dogs. In most cases, these bacteria do not cause any problems. However, if a dog has an impaired immune system, endocrine disorders, or skin damage that allows bacteria to enter, pyoderma is more likely to develop. Several factors can increase the risk of pyoderma in dogs. Poor living conditions, overcrowding, lack of cleanliness, severe flea infestations or mange, food allergies, thyroid issues or other hormonal imbalances, genetic predisposition in certain breeds, such as Staffordshire Bull Terriers, Bulldogs, Boxers, Pekingese, Pugs, and Shar-Peis. How is pyoderma diagnosed in dogs? To diagnose pyoderma, a veterinarian will conduct a thorough physical examination and may perform skin cytology tests. These tests help determine the presence of bacterial, fungal, or parasitic infections, which aids in confirming a diagnosis of pyoderma and ruling out other causes of skin inflammation. Once pyoderma is diagnosed, additional tests may be needed to identify any underlying medical conditions, such as hormonal imbalances, that could be contributing to the infection. Treatment of pyoderma in dogs. In many cases, pyoderma is relatively easy to treat. Mild cases may resolve on their own or with the use of medicated shampoos. However, if the infection persists, oral or topical antibiotics may be necessary to eliminate the bacteria causing the problem. Keeping the affected skin clean and dry can help speed up the healing process. For more severe cases, where the infection has spread or become deep-rooted, more aggressive treatment may be required. This could include a combination of antibiotics, anti-inflammatory medications, and regular follow-up visits with the veterinarian. Prognosis for dogs with pyoderma. Pyoderma is generally not life-threatening, and in most cases, it is localized to specific areas of the skin. It rarely spreads and leads to deeper skin infections. Dogs may experience flare-ups, but these can be managed by addressing any underlying health issues, such as allergies or hormonal imbalances, which can reduce the frequency and severity of outbreaks. Unlike impetigo in humans, Pyoderma is not considered directly contagious. The bacteria responsible for the infection do not typically cause problems in healthy individuals or animals with strong immune systems. Nonetheless, it is still important to maintain good hygiene practices when handling a dog with Pyoderma to prevent the spread of the bacteria. How to prevent Pyoderma in dogs? Since the exact cause of Pyoderma is not fully understood, preventing it entirely is difficult. However, there are measures pet owners can take to reduce the risk of their dog developing this condition. Keep the dog's coat clean and healthy by regularly bathing it with an appropriate shampoo, particularly if the dog has a tendency to get dirty or has oily skin. Provide a balanced diet to maintain the dog's overall health and immune system. Address any existing health conditions, including allergies, infections, or hormonal imbalances, through veterinary care. Keep the dog's living environment clean and free from parasites, such as fleas, which can contribute to skin infections. Regular veterinary checkups are essential for early detection of any health issues that may predispose the dog to skin infections like Pyoderma. Conclusion: Pyoderma in dogs, while often uncomfortable, is generally not a severe or life-threatening condition. The infection is most commonly caused by bacteria that are naturally present on the skin, but it can become problematic when the skin's defenses are compromised due to underlying health issues. Treatment is usually straightforward and involves antibiotics, both topical and oral, and maintaining proper skin hygiene. With appropriate care, most dogs recover fully from Pyoderma. Pet owners should also remain vigilant for any signs of recurring infections and consult a veterinarian if their dog's skin shows signs of ongoing trouble. Regular grooming and health monitoring are the best ways to prevent Pyoderma and other skin issues in dogs. In addition to the treatment and prevention strategies outlined, it's important to understand the role of regular skin care in maintaining your dog's health. Dogs with Pyoderma often experience flare-ups if their skin is not properly cared for, so keeping their skin clean and moisturized is key to reducing discomfort. Specially formulated dog shampoos containing antibacterial or antifungal agents can help manage minor infections and prevent future outbreaks. For dogs prone to Pyoderma, regular bathing with these shampoos, under the guidance of your veterinarian, can help minimize the growth of harmful bacteria on their skin. Furthermore, lifestyle changes may be necessary to prevent Pyoderma in dogs that are prone to skin issues. This includes controlling external factors such as flea infestations or managing allergies, which can lead to the development of Pyoderma. Some dogs may benefit from dietary changes if food allergies or sensitivities are contributing to skin infections. It's important to work closely with a veterinarian to create a comprehensive plan that addresses the underlying causes of Pyoderma. Overall, while Pyoderma is a common skin condition in dogs, it can usually be managed effectively with prompt veterinary care and consistent skin care routines. Pet owners should remain proactive in monitoring their dog's health, and any signs of skin irritation or infection should be addressed quickly to prevent complications.